Okay, hi everybody. Thanks so much for joining us for this week's Snack and Chat, Adopt for Life's weekly Facebook Live, where we explore the topics that are top of mind for families formed by adoption, kinship, and customary care. My name is Chantal, Community Engagement Liaison with Adopt for Life, and today we have two guests today and a guest host. So our host, some of you will recognize, Tracy Moisan, and our guests are Mary Jo Land and Lauri Cabral. And I'll just do a quick little intro if that's okay with everyone, and then I'll pass it off to our host. Lauri Cabral is with a Master's in Education in Counseling Psychology. She has worked in both a strategic capacity and as a regional parent liaison with Adopt for Life, running a peer support network in the Ottawa area, which permitted her to walk alongside parents who struggle with the complex needs of their children. She has chaired the Adopt for Life Working Committee on AFCCA for the past couple of years and is currently chairing the National Consortium on AFCCA. I guess it's AFCCA. Is that how you guys pronounce that?
It's AFCCA.
Yeah.
We'll get into it though throughout.
I know, that's why we're here today. We're going to talk about it. And I will be learning alongside everybody. I'll also introduce Mary Jo Land, who some of you also recognize. Mary Jo is a registered psychotherapist specializing in attachment, trauma, and parenting. She facilitates secondary attachment and the resolution of developmental trauma through family and parent psychotherapy. She is also the author of Caring Together, a guide for parents, foster parents, and adoptive parents of children who are in care. So thank you everyone for making time to be here today for this conversation. And thank you out there for if you're watching live or maybe you're watching this later on replay. Thank you for taking the time to be with us. Feel free to put your questions, comments in the chat below. I'll just take a quick opportunity to remind you that it is a live stream on our public Facebook page. So whatever you're sharing in the comments is available to the public. So you do want to be mindful and not include any identifiable information if you're asking questions about minors, so no names or health information, things like that. So much appreciated. We do love hearing from you, so I hope you find the discussion informative and engaging. I know I will. I've already learned about AFCCA, so I'm going to pass it over to Tracy and follow on.
Thanks, Chantal. Happy to be back again today on Snack and Chat and talking about this topic. It's a difficult one for many in our community to talk about, and I appreciate Lauri and Mary Jo being here today so we can continue to have this conversation. I was happy to step in today and resume my co-host duties because for the last 6 months or so, I've been able to play a dual role. Many of you know I lead marketing and communications for Adopt for Life, but over the last 6 months, I've also been able to be the program director for the National Consortium on Aggression toward Family and Caregivers in Childhood and Adolescence. And if you were to spell that all out, that's how we get to AFCCA or AFCCA, as we've been mentioning. So this is an important conversation, and I'm happy to have Lauri and Mary Jo join us. So these 45 minutes always goes by so fast, Lauri, so we're going to jump right in. Earlier this year, you published a blog on Adopt for Life's website that was called Language Matters, What We've Learned After a Year of Talking About CPVA. For anybody who might just be joining today or new to the Adopt for Life community, what is CPVA and what prompted you to write the blog?
Thanks, Tracy. So CPVA, we started out with as an acronym that represented child to parent violence and aggression, And what really happened was when we started working alongside families as peer-to-peer support, we started realizing that there were a lot of families that were experiencing aggression within their home and that they were quite silent about it until they really trusted somebody. So it was actually, we came to recognize that these were issues where the aggression was actually causing a lot of harm to the children in the home, to the parents in the home, anybody witnessing or part of that family circle. But it was actually a member or a community member from Adopt for Life that made us aware that in the UK, they were quite a bit further ahead of us in this. And they had called this thing child to parent violence and aggression. In some cases, child to parent violence and abuse, and in some cases, child to parent violence. And so we tried to find an acronym that worked for us to get the conversation started, knowing that it wasn't really perfect, wasn't Canadian language, wasn't our language. And we certainly didn't want to do any harm, but we recognized that the longer families kept silent on this issue, the more harm that was being done within the family. So I guess it was a place for us to start, if that makes sense. And in the blog, we wanted to recognize the fact that it really wasn't our intent to cause harm or to pathologize anybody or victimize anybody. It was really a first attempt at getting the conversation started.
That makes sense. Makes sense. So, Mary Jo, then AFCCA, or again, Aggression Toward Family and Caregivers in Childhood and Adolescence, is new terminology. Why do you think it's different? Is it better? Is it an improvement?
Yeah, so as Lauri was saying, we were finding some discomfort with child-to-parent violence and aggression, or violence and abuse, or violence, in that it really felt like it was blaming or stigmatizing to the children or the youth involved. And we know that this, in many circumstances and in many families, and particularly in our community, that this is a lot, that this has to do with children and their history of trauma, developmental trauma, and multiple placements in their homes. So we wanted to find a term that did not stigmatize, that did not blame, that did not cause shame, but at the same time was also easily recognizable as what we're talking about. So we really wanted to have a term that talked about what is it that we're talking about. And so, using the word aggression is a description of a behavior or an event, as opposed to aggressive, which describes a person. And we wanted to talk about that this is usually happening in the home as opposed to happening in the community. We're not talking about something that happens out on the streets with peers or anything like that. We're really talking about something that happens in the privacy of the home. And we're also talking about that it's often, but not entirely, but often directed towards the parent and or caregiver. And that this happens in a developmental way. It starts often in earlier childhood, and if left unsupported or untreated, may continue through into adolescence. Sometimes it starts in adolescence, but often more so it starts in childhood, and if not treated, goes on through into adolescence. So we, one of the youth that has spoken to Adopt for Life in our journeys through this consortium that you're going to hear a little bit more about, has said that it's not about the child and it's not about the parent. It's about what needs to happen. And so we, this terminology, we hope, is about helping people to quickly identify what we're talking about without giving harmful labels.
I think, Mary Jo, so much of what you just said echoes what we continue to hear from community parents. As you said, they're struggling with the impact that they themselves are experiencing as parents and caregivers, but there's also this deep desire to have other people around them understand what's actually happening for their child and why it's happening and how to get help. The desire to protect their child and ensure their child isn't blamed for something, while also seeking help for their whole family. Lauri, we've touched on the national consortium. Maybe you can tell us more about that, about the consortium, how it came to be, and what the primary goals and objectives of the consortium have been.
Sure. And I could talk on this for a long time, as you know, but
I'll
just
keep moving.
quickly, I think the idea behind the consortium was really, within Adopt for Life, we were getting to a point where we had a private Facebook group where families were able to talk about this, We had some support groups. We were starting a conversation, and yet we were worried, as you guys have mentioned, that our interest in supporting the family unit could inadvertently be causing harm. And we didn't really know what the solution was. As a backdrop to that, we were seeing increases in reports of aggression within the home. And Maud Champagne was doing some work through MyTex and Kids Brain Health Network that actually reported that there was a significant increase in challenging and dangerous behaviors, as she was calling it, resulting from COVID. And this was in the FASD community. And we also were starting to get calls from people from the autism community or families that were first families. So all of this kind of led us to believe maybe this is a really good time to just sit down as a country, as a nation, and say, this is an issue that many of our families are living with, and we don't know enough about it. So let's get everybody to the same table, and let's set as a goal that we're going to come up with some terminology. We're going to hear everybody's voice, and we're going to listen to it, and we're going to come up with the best possible solution so that we can move forward together very inclusively, which really has been Adopt for Life's model all along. So Kids Brain Health Network stepped up. They helped us with funding, and Adopt for Life brought together this consortium of which Tracy and I both sit on. Mary Jo sits on as a clinician. And we brought together basically 100 voices from families and first voice advocates to help us understand. And all the professionals really sat down and they listened, but the focus was really around coming up with a set of terminology, of language, of definitions, and really looking at what does it look like in families so that everybody together can come up with a game plan to move forward.
And why do you think that was so important to center on the voice of first voice advocates, youth and young adults, families, caregivers? You talk about listening to 100 people. Why was that so important?
Well, because families, first of all, families, caregivers were telling us that when they were going to talk to professionals about this, that often it was being shut down. So they needed language, and also because we wanted to create safety for families to come out and discuss this, not create any harm. So when you think with that philosophy, if you can hear from them how they're digesting, how they're reacting, you can really take their input and their thoughts. I think it's just a much richer place. It's very seldom we have like a clean slate where we can start a conversation and get that many people into the same room and really hear what the concerns are. And wow, we really heard some pretty key concerns. I actually wrote down a quote because I thought it was extremely powerful. I'm going to read it. This was a first voice advocate who said, disabled children, disabled people in general, we're at a pretty vulnerable point in society. I live on the fringe of society. Society thinly tolerates my existence. The instant I'm labeled violent, dangerous, aggressive, my place in society, which I have fought so hard to get, that's out the door. They don't want me in the first place. They definitely don't want me if I'm a danger. And I don't know about you, but that just made the whole process worthwhile. What if we missed that? What if we didn't have a chance to hear from first voice advocates on what it was like to live with this and how they felt victimized and unable to get the help they needed to move forward. So anyway.
Lauri, could you just mention the other voices on the consortium?
Sure. There were basically, so really we had this first voice group that we had, questionnaires, one-on-one interviews with, small group interviews. And then we also had some representatives on the main consortium, which was a group of 15 professionals, and they came from academia. So we had, social work, psychology, criminology at the table. We had police, probation officers, we had child welfare, we had psychotherapy, psychology, occupational therapy. There were basically, it was meant to be a Canada-wide rich discussion from the various areas that came together to digest this information. Is that helpful?
To that end, too, the cross Canada piece, I know the consortium has had representation from extensively within Ontario, but also from Quebec, from Manitoba, from British Columbia. Our first voice advocates and families and even other practitioners who stepped forward and provided feedback represent really coast to coast, from PEI to British Columbia. So there is a wide set of perspectives represented. Mary Jo, can we maybe talk a little bit about impact? I know the consortium heard a lot from, again, all of these voices about the stigma, the shame, the blame, but they also talked about other impacts as well. Can you maybe, if you start with parents and caregivers and other family members, start there and talk about what key impacts that you've heard and what you've noted?
Well, I think the first thing is for parents, there's a tremendous amount of shame, isolation, fear, shame in that, why can I not make this not happen in my family? How is it that I, as a parent, smart parent, I've done everything, I've read all the books, I've done everything I can. How is it that I cannot stop this from continuing? Like, why is it still happening? And also not really knowing anyone else perhaps that is going through this, because it's although it's for us, it's fairly common, but for each individual family, they may not know anyone else that is experiencing this. So there's a lot of feeling of shame and isolation. And of course, as your child gets bigger, and sometimes parents are becoming afraid, and to say I'm afraid of my child is a very, very, very difficult thing to say, even if the child is 15 or 5. And so parents worry that they have other children in the home, and they're trying to prevent the other children in the home from experiencing the dysregulation and the outbursts and the storms that are happening in the family, and trying to meet everyone's needs simultaneously when the needs are so great. So I think that, parents worry that if they talk with a professional, that they will be dismissed, that will be minimized. Oh, well, kids do that. That they will be not believed, that they will be thought of as being bad parents, that the Children's Aid Society will be involved or police will be involved. And they're worried about what would the impact be if they told someone and then the Children's Aid was called, especially in our community here in Adopt for Life. What would this mean about our adoption if this went back to the CAS? So, in all, it's often very hidden, very secret, and that results in a tremendous amount of isolation. And when parents connect, as they have been connecting through Adopt for Life, and they find the support, it is, and it does become a lifeline. And of course, then you can start to provide resources, and just the connection, just to know that you're not the only one, that other people are also struggling, that this is about parenting children who've been really hurt within the child-parent relationship in past years. And so, I think that that's the main thing. We want to help people understand that this is a thing, and it happens in different families. The incidence is fairly high, and that if we connect, we can support each other and also create in our society resources to help everyone.
You mentioned that wanting it to be more understood, and we talked earlier about first voices and the youth that stepped forward to very bravely share their experiences. What did they have to say about impact and what they wish people understood better?
So, when we think about children who've had multiple placements and who've been shifted from family to family, through their early years or in earlier parts of their childhood, part of that outcome is that you feel not very lovable, not valued, not worthy. And so if one of the things that happens, if you are acting out your trauma and distress and dysregulation and trying to communicate the degree of your suffering, really, and that form of communication has elements of hurting other people or yourself, but hurting other people too, then that feeds into a person's identity about, see, I really am unlovable. I hurt the people who are caring about me. I hurt the people who care for me. I hurt the people whom I love the most. And so what kind of a person am I? And so that the aftermath often includes a tremendous amount of shame for the person who is acting and communicating their distress. Sometimes that shame and fear of hurting other people that you love means, I need to get out of here. I need to leave. I can't be near these people. And so, I don't want to be the person who hurts my parents. And typically, because this happens in a state of dysregulation and it's a result of trauma, there isn't an intention to like a criminal intention that premeditatively I'm going to set out to hurt this person. It is an expression, it's a communication that usually results from dysregulation. So there is a lot of shame that happens afterwards.
So often we heard that, right? Just behavior is communication.
Yeah.
For me, that was such a key takeaway, and it sounds so simple, but it was so clearly represented. Chantal, I'm just going to pause for a second. I know we're already halfway through. These go so quickly. Is there anything you want us to address or any comments in the chat that we should come back to?
Classic, trying to talk with the mute button on. No, I think everybody's just wrapped and you have their undivided attention. No one's asking any particular questions at this moment.
Well, let's keep going then. Lauri, let's maybe pivot a little bit and talk about, so what did the consortium learn about what might help? What were some of the common needs that were identified that would directly help support families that are experiencing this? And maybe as you think about that, how do the needs of parents and caregivers differ from what you said would help?
Gosh, I think in a way it's a little bit of a continuation of what Mary Jo was talking about. One of the things that really struck me was one of the youth saying, I'm afraid that if I don't figure this out as a youth, that I might bring it into my adult relationships. Am I going to be dysregulated with my partner or with my children? And so there was this overall theme right from the get-go, from the first voice, that they wanted to talk about it. So they even said right at the get-go, like, okay, maybe the language isn't perfect, but please don't stop talking about this. It's so important for us to get this out. And they want to talk about it without feeling shame. So this sense of wanting to normalize it a little bit, that people that come with neurodevelopmental disabilities or disrupted early attachments are likely to use this form of communication at some point. So instead of allowing it to just stay and become kind of stuck in our patterns of behavior, please help us.
Yeah.
So they kind of use this. It should be anticipated. And I think that was a really important message for us to hear in terms of a lot of the work that we can do early on, that it's not such a big shock when this does happen, so that we can anticipate it. We can put in place ways for them to communicate appropriately, or when communication starts going the wrong way, we can help by intervening a little bit earlier. The parents talked a lot about how crucial it is for them to remain the experts in their own family. That when sometimes when they do raise this, they end up at some table where they're not either invited or they're not welcome, or there's so many professionals at the table that they're overwhelmed. And so they talked a lot about that. And I think that's a really important message for us within our community, to recognize, we're lucky we have each other, and to use that, but for professionals, that parent must remain at the center of what's working. And the youth actually ask for the same thing, to be included in solutions. So don't make it about them, make it with them. And the other thing that really stuck with me, and I know this to be true, is the roadblocks. How many roadblocks people have to face before they can find something that can work for their family. So a lot of talk about how exhausted they are by trying all these things, and how many times they're told no, or that they don't qualify for something, or that's not available, and how important it will be to have multidisciplinary teams moving forward, so that people are talking together with the child and the parent at the center of these discussions, in whatever format that works for them.
Yeah, and also we know too, Lauri, that this can start very, very early in childhood, because one of the things that we see with developmental trauma, the two outcomes are really trust in caregivers and the ability to regulate, self-regulate. And so we see that often the distress, the trauma, is expressed through dysregulated behavior, which speaks to the intention behind the behavior. And that it is a communication of distress and suffering, and that early intervention is very helpful, so that those patterns of behavior don't become entrenched. And so we really do need to focus on helping in early years, helping around regulation, co-regulation of the child, in order to teach self-regulation, and so that the youth have had the opportunity to learn through co-regulation their self-regulation, and so that can be very, very helpful as time goes on.
I think you'll see throughout the report, which we'll mention later, is this dance, as Mary Jo says, between the importance of early intervention, so recognizing signs and risks early on and getting help, and then also helping when a family does go into crisis. So it's really, this two-pronged, let's start at the beginning, let's get things in place so it doesn't have to become entrenched. And then when there is crisis within the family, let's step up quickly without too many barriers, so that we can actually support that family through it. This kind of wave vision. Yeah.
That makes a lot of sense. Is this still the question I have for both of you next is definitely still related to this topic, but maybe looking at it slightly differently. November is Adoption Awareness Month. At Adopt for Life this month, we've really been focused around and talking about this idea of language matters, and a lot of different conversations we've had in different channels about language and the power of the words that we choose. I will plug for a moment anybody who's watching. We were hosting a live panel tonight talking about this, so you can find that information on our website. But I'd love to know from both of you, and Mary Jo, maybe start with you. Why does language matter so much around this topic in particular? And when we talk about aggression toward family and caregivers, why do the words matter so much?
Well, I'd like to hearken back to that quote that Lauri gave us early on. If you're labeled as aggressive, as violent, these are labels and descriptors of your personhood, which is indeed very shaming and blaming. And we're really trying to create language that does not cause harm to the children and youth that have already suffered tremendously through their early experiences, through multiple placements, and in our community through multiple placements often. And so we're trying to really find ways of using language in a way that does not blame, that does not shame, that does not stigmatize, and that really helps us to understand the degree or how small the degree of intentionality is, that this is really about trauma, it's really about dysregulation, it's about communicating distress and suffering, and it is not about being intentionally violent and or intentionally aggressive. And so especially before there's like years of entrenchment. And so if we're using a developmental trauma lens for this experience, this event that happens in the family, then we are using, if we're using that lens, then we are understanding that this is about what happened in the child's or youth's life as an outcome, and it's not about them being, like having a criminal intent in this behavior. And so that's really what we're hoping for, is that results in a therapeutic, helpful, healing response, as opposed to a punitive or criminalizing response.
Thanks for that, Mary Jo.
Yeah. And I think to me, one of the things that we should be really pleased about in Canada, really, in how we're dealing with this, is the fact that those voices are being heard and will continue to be heard as we move forward. There are things that we couldn't have thought about if we were just taking a parental lens or a caregiver lens, or if we were just taking a clinical lens. And I think for the three of us that were at the table, there was a moment where a young person who had grown up in care actually said, the minute you're labeled a violent child, you no longer have access to foster homes. You're going directly into a group home, and nobody's going to ask you whether you were protecting a sibling or what that was about or why that incident happened. And I think these things could not have been more powerful for us, and it couldn't have been more of a privilege to be able to hear them,
Exactly.
because our hope is that those voices will continue to inform how we move forward with this. And I was also really pleased. I know we keep talking about the consortium and the report. Well, it'll be out early next year, but one of the things that has been committed to is to continuing to run things by like a truth testing moving forward, so that we're sure that how we're dealing with this is taking into account these various perspectives.
That's so important. In some ways related to that, we had a guest on Snack and Chat earlier this month. She's an adoptee herself and a first voice advocate. And in this context of talking about this idea of language and the evolution of language, she posed a question that has really stuck with me for really as we've been having all of these conversations this month. And she was talking about words or phrases that she wished parents, caregivers, professionals who work in and around adoption would unlearn or remove vocabulary. And it really struck me. It made me pause and think, what words do I need to be unlearning? And so I'd like to channel that back to both of you as you think about this work, but also if you think more broadly about the families that you support in the Adopt for Life community, and more broadly, are there words that you think we should be unlearning or removing to be respectful of youth and families and first voices?
Yeah, I'd like to say right away the words that label a person as opposed to describe an event. So aggressive as opposed to aggression. And sometimes there is violence, but that's different than saying someone is violent. And I think we have to be very, very careful when using words that describe a person as opposed to words that describe an event. We learned at this table about how much of this is about not being able to communicate. We know that when someone is very dysregulated, the ability to use the prefrontal cortex and the language centers is diminished when you're in a high state of arousal. And so the communication modality becomes behavioral. And of course, fight, flight, freeze. Fight is part of the response in a survival response by the autonomic nervous system. And so when we see this fight, if we think of it as a survival response, then we are able to respond more therapeutically, as opposed to thinking that it's manipulative or controlling. And I think those are two other words that I like to avoid, that these are survival strategies, and they're very resistant to being given up, because we don't give up survival strategies that have helped us survive.
So true.
And if you lived with a tremendous amount of violence against you, you need to learn to protect yourself, and you need to learn to survive. And if we see this as this is a strength from another situation, then it's, and we can recognize how much harder it is to just ask someone to not use
stop.
their survival strategies. Mhm.
Yeah. Lauri, what about you? Anything come to mind?
Yeah, I mean, I think the ones that I think Mary Jo has pretty much touched on the themes and the meaning. And I think the people at the table really were very against anything that used abuse as well, that they felt that relayed something that was not reflective of intentionality in this case. So there was like abuse, and there was violent, and words exactly as Mary Jo said beyond that. But those words were definitely things that assigned a meaning that we may not have anticipated had we not heard about the outcomes of those words. And so I think really, to me, when you talk about language matters, you want to look at the people that are most heavily impacted by any language that you're using and ask them
Exactly.
what we should be using and how we should be reflecting on it before decisions are made.
So we have about 8 minutes left. I've got 2 questions, one about the consortium and what happens next. And then I want to recognize that there may be parents, caregivers, families who are watching or listening to this who need help. So let's tackle the consortium piece first. Lauri,
Sure.
what happens next? The consortium is
I'll be quick. So we're wrapping up the report. The consortium was intended to be very quick, 6-month project, so that we could actually lay this foundational work, and everybody across Canada could then be starting from the same starting point. So the report will be probably out to the public early February, I would think. And then the consortium will move on. Everybody at that table has pretty much demonstrated an interest in staying with it, and then moving towards on some of the recommendations that include things like greater awareness, more education for professionals so they understand the language, they understand what it is, anti-stigma work, so that we can get past some of the problems that everybody has said exist currently. There'll be research. I want to do a little plug for Ottawa U is currently doing a research project looking at what AFCCA or CPVA, as we currently are using, looks like in homes. And I strongly encourage you guys, if you have the chance to participate in that, it will help us move forward. And then in the report, they're also talking about looking at ways to intervene earlier, keep the family as a key player, and better crisis response. And I guess that they're talking a lot about respite as well, and the need to figure out ways to get better and trained and available respite. So that's about it.
And I think Chantal may have put the link to the University of Ottawa study in the chat.
Good. Thanks,
Anybody who
Chantal.
is interested in that. And that is open, similar across, that is not just limited to Ontario. So if you're watching this from outside of Ontario, please also click that link. And I know that team is very specifically looking for a very wide set of experiences to understand. So Mary Jo, maybe the last question to you. If someone is watching this, they're a parent, they're a caregiver, maybe they're a youth themselves, and they're experiencing this in their home and they need help. Where can they start?
Well, I think one of the best places to start is Adopt for Life, because I think Adopt for Life is at this time really leading the development of understanding at this point in Canada. And I think that we at Adopt for Life have some great resources on the website, and I would encourage people to look at the websites. There are some videos, there are webinars, there are resources. There is also an online Facebook group that you have to be kind of screamed to get into, but that means you get to connect with other families who are experiencing this. And I think to be connected with other families and other people reduces the stigma, it reduces the shame, and it reduces the isolation. It can reduce your fear and really just help you to know you're not alone on this journey, that there are many other families who are on this journey. There are support groups starting up again in January. And so, try to reach out, make sure that you're not alone. Share the story of your family with people who can be resources to you. Sometimes it's very helpful to have another person who can come in and support you if it's a very difficult time, and come in non-judgmentally and be just a safe presence. And develop a safety plan. Everyone in the family should know that there is a safety plan. Everyone in the family should know what triggers the safety plan enactment. And that safety plan may, at the end of the plan, when other things have been ruled out or tried and they're still not working, that may end up with needing to call a crisis line, call for crisis support, and at the very at the very end point, it might be needing to call the police for assistance. But if you think that might be something that your family needs to do, certainly it is best to sit down and have a conversation with the police in your location, and have your address identified as an address with a person with some mental health needs in the family. And that if you are calling about this person, that for instance, in Toronto, you might have the mental health crisis response team come. And in other communities, you would have someone coming who understands that they're dealing with mental health as opposed to criminality. And getting a therapist who is adoption, developmental trauma competent would be very, very helpful. There's a couple of webinars about nonviolent resistance, NVR, on the Adopt for Life website. And so you may have a chance to look at those. And mostly, because your job is to try to re-regulate your child when they are dysregulated, you need to remain, as a parent or caregiver, you need to remain regulated yourself. And so taking the steps that you need to take for yourself to be able to remain regulated in the face of your dysregulated child, in the presence of your dysregulated child, and doing the things that you need to do for yourself to be able to do that. And, it's that terrible word, self-care, but it really is about making sure that you yourself are well, healthy, and well supported. We can't do it alone.
No.
We are right at the top of the hour. Mary Jo and Lauri, thank you so much for sharing your perspectives and sharing what the consortium has learned and some of the stories and experiences that we've heard over the last 6 months. For anyone watching, I know Chantal is populating the chat pod with some of the resources that have been talked about here today, including, if you're part of the Adopt for Life community, how to access the private group that Mary Jo mentioned as well. So I want to thank both of you for coming and for having this conversation. And Chantal, I will turn back over to you.
Tracy, I'm not going to add too much. I think that's just echoing what I was going to say, is just thanking all of you, including you, Tracy, Mary Jo, and Lauri, for, I know how busy you are, but taking the time for this important discussion and bringing this discussion and this language to those outside of those private groups, so we can do our best to remove the stigma and keep talking about it. So just thank you so much. And again, like Tracy said, if you have questions, if you're not sure, send us a direct message and take a look at the resources on the website. So bye for now. Take care of yourselves.
Thanks a lot.